The program is against all odds on the Nigerian Television Authority, the NTA. You know, for some time now, I've actually encountered a number of persons with disability, and my interaction with them actually widened my scope and gave me an understanding that most of these people were not born with disability. Some of them acquired disability along the way growing up. And so, with this in mind, we sought to meet a doctor who will help us. You know, you really cannot twist or turn the plan of God for a person. But yes, to an extent, with knowledge, we can prevent a lot of things from occurring. And so today, on this episode of Against All Odds, we have with us a medical doctor who will be talking to us on how to prevent, on, signs you need to see or look into to avoid your child, your word, or you yourself becoming a disabled person. Don't go away. We have so much packed up for you on this episode of Against All Odds. My name is Doshima Pius Ikerovi, and for inclusion, I have with me Queen Janet. Don't go away. We will be back. Don't go away.
This is Against All Odds.
The 2006 Nigerian census reported 3,253,169 people with disability in that year. And among this figure, there are persons who were born with disability and some who acquired it along the way. What are the causes of disability? Can it be prevented? What are the signs that can be looked out for? To get answers to our questions, we sought a medical doctor's advice. Time is of essence, as teaching time saves 9. Don't wait until it's too late.
This is Against All Odds.
I have with me on Against All Odds, Dr. Otabo. Yeah, it's our pleasure. Thank you for, squeezing us into your very tight schedule.
It's my pleasure.
I have been privileged to meet some persons with disability, and in the course of my interaction with them, some will say they were born with disability, but a lot of them acquired disability along the way, at a very tender age. And so with that in mind, I felt we should, get more awareness from a medical doctor who will be able to tell us the causes of all these disability issues and maybe probably preventions for future occurrences. And that's why we're here, to talk about symptoms, signs, and then preventions.
As you
can see,
I'm a
postlingual deaf person.
I can talk.
I will not have much challenge.
Talking about deafness, there are two broad types of deafness in terms of causes. Like we alluded to before, the congenital and the acquired. Yes, the congenital deafness due to some malformation in the hearing pathway, or due to excessive growth of the bone within the skull, it can lead to deafness. Yes, but there are also acquired causes of deafness.
Okay.
Yes, and the acquired causes can range from infection, like meningitis. Yes, when meningitis occur, when it's an infection, it affects the meninges, the covering of the brain, and from this covering, the nerves that ensure hearing also take its root going into the ear. So if the meninges are inflamed, it can also, the infection can spread to the ear, and or the nerves that elicit hearing, and so if it affects that nerve, it often leads to deafness. Then there are other causes. Even trauma to the ear can cause deafness. If there's, that's why we advise people not to slap on the ears, because it can break the eardrum and lead to deafness if it happens on both sides. There could be partial deafness or complete deafness. Yes. Then also drugs, medications like chloramphenicol and gentamicin, they have what we call ototoxicity. That means it's toxic to the ear. Yes, either the ear itself or the nerves that ensures that we hear. Then still on deafness, Lassa fever is one of the causes of deafness. Yes, in a good percentage of people, up to 1/4 of Lassa fever patients, one of the ways you know that you diagnose Lassa fever is when there's deafness in a patient who is bleeding from the orifices with fever and all that. So they quickly go into deafness, and many times the deafness is not reversible. Yeah, so these are some of the causes of deafness. Yeah.
Okay.
Yes.
So any preventions to avoid such things?
Yes, in terms of congenital deafness, there's no way you can prevent it, because the child is born that way. It's a defect in the formation of the child. Yes, you can't do much about it. In terms of trauma, you can prevent trauma, raise up the child in the proper way so that it doesn't get involved in fights, and you also don't discipline your children by slapping, and all that. So that can help reduce the incidence of injury to the eardrum that can lead to deafness. For medications, avoid ototoxic drugs like chloramphenicol and gentamicin. Of course, I'm talking to the doctors this time because they are the ones that prescribe it. Yes, so that's for the acquired. Then for meningitis, usually for meningitis to cause deafness, it must be the severe one. And meningitis starts like mild infection. If nothing is done, it become more severe, and then until when the child becomes probably unconscious, stiff and all that. So early detection, when something is wrong, when you notice that the child is not normal, it might just start by refusal to suck, or maybe fever, mild fever. That's when to respond. If the child is taken to the hospital and they check that the sign of infection is treated, and treated adequately. But if nothing is done on time, it progresses until pus starts forming around the brain and the ears. Then there's not too much we can do in terms of prevention. So to prevent those dire complications is to prevent it from getting that to that stage. So early presentation to the hospital, to the doctor, to a specialist can help prevent that kind of deafness.
Okay, thank you very much, doctor. Okay, so that is it for deafness. Okay, now let's talk about physically challenged persons. Okay, there's some cases, there's a particular case that actually kept me wondering. The boy said at age 4 he slipped on water and he fell down, and then he became physically challenged. And so many other cases like that, of persons that said, I was born but I felt sick along the way. One said quack doctor injected him, and it now led to him being physically challenged.
They never born me like this. After 7 years, the problem, my junior sister, our village, then they wash baby inside that thing where they wash baby girls. The time when water fall inside my mother room, I start running. When I fall, that's all God be. Any hospital, my father carried me to any hospital. But God saw me like this up to now. But they never born me like this.
Big Dream ordeal occurred at the age of 7 when he fell ill and was injected by a quack doctor, which affected his vein and left him crippled.
This is the way and manner physically that I came to this world. I was born like this. My mother gave birth to twins. My twin sister came out first, and I came out second. Fortunately, that time unfortunately, but for me, I'm fortunate to be like this.
In terms of physical disability, it's a broad spectrum. Like we also classified it at first, we can classify it as congenital, which means the child is born that way, or acquired, which means the person acquired it somewhere along the line. Maybe we should start with the congenital one first. In congenital disability, you can have things like spinal bifida. Spinal bifida, it's a condition that affects children, or is seen in children. They may grow up to become an adult, in which the spinal cord, the development of the spinal cord is faulty. Yes, because the spinal cord starts normally as a plate, then over time it folds to become a tube, and then you have the nerve cells developing along that tube. But if that plate refuses to close at a certain level, so it persists, and then you say it's spinal bifida. Yes, and then the nerves are exposed, the nerves are degenerated, they are not well formed, they are atrophic, and so because of that, from that part of the body, usually around the lumbar region, the waist down, where the nerve is not formed, the child is paralyzed. Yes, so those children, most of them are confined to wheelchair from birth. I mean, from time, because there's nothing you can do about them. There are a few that are not so serious that the neurosurgeon can help to close, and they can manage to walk and have some level of strength in their limbs. So spinal bifida is a common cause of those children, those people you see on wheelchair, that they were born that way. Yes. Then still on the spine, like the young boy you talked about, that child had, is not, this time it's not a congenital condition, it's acquired, because the child was walking, playing, and then he fell.
Yes.
So he probably sustained a spine injury, maybe a spinal cord injury. Yes, and the child was not appropriately treated, or the spinal cord injury was very severe, because sometimes when the spinal cord is transected following a fall or following a gunshot or something, you can't do anything about it. It's gone, it's gone. And so the person will have to adapt, get on wheelchair, and continue life that way. So that's what must have happened to that child. Apart from that kind of fall from heights for big people who are walking on site, road traffic accidents, they are common causes of spinal cord injury. Yes. Then penetrating injuries to the spine, like gunshot wounds, stab wounds, ballistic injuries like bomb blast and all that, they also contribute to cases of spinal cord injury. So, but apart from spinal cord injury, there are other types of other causes of disability, which is physical disability, like paralysis that is not spinal cord related, like polio. A child is fine up to around the age of 3 years or 4, suffered a fever, went to take some injections, then after some time, both legs are paralyzed or one leg is paralyzed. Unfortunately, because the paralysis occurred around the time of the injection, parents often erroneously link that paralysis to the injection. Yes, but it is not most of the time. There is another component of such paralysis that is called injection pulsing. But more often than not, you have polio paralyzing children.
My physical condition occurred when I was 4 years old. The doctor attributed it to polio. So from that 4 years till now, it's now been like this. From one hospital to the other.
Polio presents like fever. I mean, it presents with fever. It presents with other things that looks like malaria or other infection. And so the parents will have to take the children for treatment. And part of the treatment many times is injection. Okay, but usually there's a period after like the 3rd day or the 4th or 5th day, the paralysis sets in. And it usually coincides with when the injection is still going on. So polio is a dangerous condition that has claimed a lot of lives and has led to the paralysis of many children. But thank God the federal government of Nigeria is taking polio very seriously. And the effort is on to eradicate polio from our society. Nigeria is just one of the 2-3 other countries that still have polio. Yes, it used to be the pain countries: Pakistan, India, Afghanistan, and Nigeria. I think India has exited that list, so we have PIN now: Pakistan, India, Pakistan, Afghanistan, and Nigeria. Hopefully, soon Nigeria will eliminate polio. So it's a common cause of paralysis. Okay, and other causes of paralysis that acquire tuberculosis of the spine. Yes, in children that grew up in areas where poverty pervades and hygiene is poor and ventilation is poor. The tuberculosis, and then where they also take a lot of unpasteurized milk, the tuberculosis bacteria, Mycobacterium tuberculosis, finds its way into the intestine and then into the blood. From there it moves around, settles in the spine, and begins to destroy the vertebra. And then there can be a collapse, and then also can colonize the spinal cord and render the child paralyzed. So such children, if they don't seek adequate care, they just get to the wheelchair, and then they become like that, for a long time. So these are some of the causes of paralysis. There are other conditions in which you have complete absence of limbs, either one or two of the upper limb or part of the limb, or absence of a finger or all of the fingers, yes, or the toes. It's what we call amelia. In medical terms, it means absence of limbs. It can be congenital, it can be acquired. In congenital conditions, the child is born that way. Usually, when bone is formed in the body, there's a cartilage enlarge that forms where bone are going to eventually form. So those cartilages are eaten up by cells. We call them osteoclasts. As they are being eaten up, bones will now lay on them. But in areas where those cartilages do not appear at first, when bone is now forming, there will be no bone there. So you have loss of bone, sometimes loss of limbs and all that. And it's commonly caused by medications that mothers take when they are pregnant, especially during the first trimester of pregnancy, within the first 3 months of pregnancy. That's when the damage is done most of the time. Assuming that the child has fallen or the child is sick, it is wise to seek medical help immediately. Many people try funny things at home, they give concoctions at home, they do all sorts of things. You are not a doctor, you are not a doctor. There must be something the doctor knows that you don't. So it's advised that you present early to the hospital so that the child can be checked. And if something needs to be done, that thing should be done. Especially for little kids that can't take a decision for themselves. They are so innocent. They depend on us, the parents, to make good judgment for them. So you notice your child is having fever, child's condition has changed, move straight to the hospital. And then an intervention can be given on time. Then there are many of these conditions that are vaccine preventable. That means that if you take your vaccines, polio vaccine, all the NPI, National Program on Immunization, you are not likely to have some of these things. Immunization is the cornerstone of prevention of polio. The reason polio is still are with us is because people escape from the immunization route, trap. So when you are not immunized, you become dangerous to others. But if you are immunized, you won't have it. Then we should also, I think, the speed limits for on our roads, the government should look into that. There's also blindness. Blindness can also, because we have a lot of blind people around.
Yes.
Yes, and blindness can also be congenital or acquired. Some people are born blind. Yes, like if they have the touch complex, there's a class of disease we call the touch complex. Okay, toxoplasmosis, and all those. It's a group of diseases, about 5 infections, rubella, cytomegalovirus and all that. So we normally will screen for that in pregnant women to make sure that they don't have it. If they do, we treat, because if they have it and they are not treated, they can come down with blindness. Yes. So congenital blindness is common. Is with us. Then acquired blindness. Some children are born with glaucoma. Glaucoma is increase in the eye pressure.
As in born.
Yes, they are born today and their eye pressure is high. Yeah, because of a defect in the pathway of the fluid that circulates in the eye. When the fluid increases in pressure, there's no outlet. The pressure builds up and it can blind the eye. It can cause pressure on the optic nerve, and then the fellow can be blind. Yes, so when a child is born, that's why it's good to do a proper exam. That's one reason why people should not be encouraged to give birth at home, because there are many things to look out for in a child soon after delivery to ensure that some of these things are not there, because if it's there, we can take care of it immediately. Like a child who is born with congenital glaucoma can be treated. Yes, the surgery can be done within a few days of birth, and the child will be fine.
Okay.
But if that child is neglected, within 6 months the child will go blind, and that blindness is for lifetime. So those are some of the causes of congenital blindness. Yes. Then infection can cause blindness. Even meningitis can cause it. Yes. So many things. Even river blindness, an infestation with. You've heard about river blindness.
Yeah.
Yes, it's caused by some form of parasitic infection. It's common in some riverine area. Yes, and then cataract is a common cause of blindness in our environment, because the lens is supposed to be plain. You shouldn't see it. If you see it as white in front of the eye, that's cataract. Yes, and we can have congenital cataract, we can have acquired cataract. They are causes of blindness. Yes, And then, of course, trauma to the eye can also lead to blindness. So these are some of the things that can give disabilities.
I've had a fantastic time with Dr. Otabo. You know, they say knowledge is power. When you're empowered with knowledge, there is nothing you cannot avoid. A stitch in time saves 9. For me, today, I have gotten the clarity of that word. It is better for you to save that one stitch than having to stitch 10 times. I'm sure you've been enlightened on Against All Odds today, and you will take everything Doctor has said home and work on it. Don't sleep on it. Thank you for staying with us. Let's do this again, same time next week. My name is Doshima Pius Ikirafi, and with me, Queen Janet. Walking out of Dr. Otabo's office, I said to myself, indeed, prevention is better than cure. Together, we can prevent disability.
Audio Jungle.